Hello, I'm Dr. Ashley DeLeon. I'm a board-certified general surgeon and trauma surgeon and fellowship-trained transgender surgeon practicing at the Crane Center for Transgender Surgery. We are a group or a team of several surgeons with multiple practice sites within the U.S. who provide surgical options from head to toe for trans men, trans women, and non-binary gender fluid individuals. Our collective backgrounds encompass plastic surgery, urology, reconstructive urology, general and colorectal surgery, craniofacial surgery, microsurgery, and gynecology. And we've all quit our day jobs, so to speak, and have dedicated our careers to the trans community. We perform gender affirmation or gender affirming procedures for patients that come to us from all over the world and pride ourselves on providing both comprehensive and compassionate transgender surgical care. Today we're going to be discussing how we approach the insurance companies to get your medically necessary procedures covered, and specifically we're going to be talking about this today in regards to the nipple areolar complex reconstruction during chest masculinizing surgery, or in other words, the nipple grafts during the double incision top surgery. We have come a long way since Dr. Crane first opened the practice in 2012, when we only had about 10 to 15% of our patients covered by their insurance. And so the majority of our patients were essentially forced to bear the financial burden of their procedure alone. Dr. Crane not only pioneered and perfected many of the operations we do today, but he was also one of the first transgender surgeons to say, hey, we're willing to work with any insurance company. So since that time, through a lot of hard work on your part and on ours, battling trans exclusion policies, which are now illegal, fortunately, and persuading politicians to do the right thing for the trans community, we are proud to say that about 85 to 90% of our cases are now insurance-based. And this is incredible considering where we started. What I want to share with you today is what goes on behind the scenes between the insurance company and our practice during the authorization process. So this involves personally advocating for you, with our ultimate goal being the insurance company approving your entire procedure. So at the Crane Center for Transgender Surgery, we have an entire team of experts in billing and insurance that are specifically employed to help us get your medically necessary procedures approved. So how it works, this team initially will submit a set of codes called CPT codes to the insurance company that encompass the various procedures that we plan on performing during your surgery. Once the insurance receives these codes, they can then either approve all of them, approve none of them, or possibly only approve part of them. Should any of the codes get denied for surgery, the next step is to submit an appeal on your behalf. So part of this process often involves a peer-to-peer call between your gender affirmation surgeon, such as myself, and a physician who is employed by the insurance company. Now, the insurance physician is typically a primary care physician of some sort, so may not understand the nuances of surgery, especially gender affirming surgeries, but is knowledgeable about medicine in general. So then it's our job as your surgeon to then have an educated discussion with them and help them understand why your procedure is medically necessary and thus should be approved for coverage. So specifically with chest masculinizing surgery, we frequently get denials on the nipple areolar complex reconstruction, in other words, the nipple grafts, for this portion of the case, as they state that it is cosmetic and that it has no functional purpose. So let's look at some background information first. So a cosmetic procedure is when something that is already considered quote unquote normal is enhanced surgically. So for example, if I as a cis female wanted to have breast implants placed to make my breasts appear larger or to enhance them or to augment them, then this is considered cosmetic because I am enhancing an already normal structure, okay? Now, a reconstructive procedure, on the other hand, is when we take something that's considered abnormal and we're reconstructing it to make it appear normal again. So for example, take a cis female again, but let's say she has breast cancer and has had a mastectomy or removal of the breasts to treat her cancer. So she no longer has breasts, which that is considered abnormal, right? So therefore, if we place breast implants in this patient population, it's considered reconstructive, not cosmetic. So that's kind of the cosmetic and reconstructive piece of it. Now let's look at function. So when it comes to function, cis women have functional nipples as they're utilized to breastfeed infants, okay? That's their sole purpose. For cis males, their nipples are not functional. They don't serve a functional purpose. So keeping all that in mind, when I'm doing a peer-to-peer review with the insurance company's physician for the nipple areolar complex reconstruction, or the nipple grafts during chest masculinizing surgery, I utilize this information to build basically a compelling argument to hopefully overturn their denial. So in using the case of reconstructed breasts for cancer patients is actually a great example to help them understand both the differences and similarities, because breast reconstruction is always covered by the insurance companies in that setting, as it should be. But we want them to understand why it shouldn't be looked at any differently with chest masculinizing surgery. And then it allows us to discuss then both the differences between reconstructive and cosmetic procedures and functionality. So first, I always ask, is it considered normal for a male to have nipples? And no one can deny the answer is yes. I then point out if they agree it's normal for a male to have nipples, and they must also agree that the converse is true, and it would be considered abnormal for a male to have no nipples. So if it's abnormal for a male to have no nipples, when we're doing the nipple areolar complex reconstruction or the nipple grafts during chest masculinizing surgery, we are by definition taking something that's abnormal and making it appear normal again. Does that sound familiar? It should. This is the exact definition of what classifies as a reconstructive procedure. So then let's take it a step further. We can agree now the procedure is reconstructive and not cosmetic, but what about function? So male nipples are not functional. I agree with that. However, when we turn our attention back to the scenario of a breast cancer patient who has had their breasts removed and then reconstructed with nipples, do their reconstructed nipples have functionality? In other words, are they able to breastfeed an infant with them, which is the sole functional purpose of female nipples? Well, of course not. The breast tissue and all the ductal systems have been removed during the mastectomy. So therefore, the insurance company is paying for nipples to be reconstructed in a cis female with breast cancer, as they should, of course, but because we all agree it's normal for a female to have nipples, and thus it's considered reconstructive surgery. And it's not because it restores function, because it doesn't restore function. So with chest masculinizing surgery, we're taking something abnormal and making it and creating it into something that is normal, which is a flat male chest with masculine nipples. Although it doesn't restore function to reconstruct the nipples during chest masculinizing surgery, nor does doing nipple reconstruction for a breast cancer patient. So if they deem it normal for a female to have breasts and nipples and thus label this non-functional surgery as reconstructive and approve the coverage, how can they decide nipples for a trans male are cosmetic and deny a trans male his nipple reconstruction when they also acknowledge it's normal for a male to have masculine nipples? So chest masculinizing surgery is not a cosmetic procedure. It's a medically necessary reconstructive procedure to provide mind and body gender congruence and help alleviate gender dysphoria. So by discussing this in the context of other operations they do cover, it's then easier for them to see that their policy is inconsistent. So denying a transgender patient nipple reconstruction is therefore discriminatory in nature. Then if there's a lot of resistance to change, I also then like to highlight that denying the nipple reconstruction is not only discriminatory, but it also can be dangerous for the patient. Forcing a trans man to walk around without nipples makes it obvious to others that they have a surgically created chest. And this puts them at risk to become a victim of discrimination and hate crimes. So as world-renowned experts in gender affirmation surgery, we believe it's important to keep the transgender patients safe and in a discriminatory society, essentially, which is why the nipple areolar complex reconstruction is a medically necessary procedure to treat gender dysphoria by helping achieve gender congruence, and thus should be approved along with the mastectomy. Now again, this doesn't guarantee they will approve the appeal and cover the surgery, but it does provide them with a compelling argument and gives us a really good chance of getting it overturned. If not, and they say they're unable to cover the procedure since it's just not in their policy, then we ask that they bump it up the chain and that they speak to their superiors. It is that physician's job to function as a medical liaison for the insurance company and affect policy change so that their company, in order to ensure that they're approving medically necessary procedures for their beneficiaries and in a non-discriminatory manner. So the onus is on them now to do the right thing. So it doesn't always work out, but we have a lot of success in approaching it in this manner and are happy to advocate for our patients, and we do so routinely. So thank you so much for listening today. I hope this was informative for you. If you have any questions, feel free to visit our website at www.cranects.com and reach out to our office. And then keep in mind too, and always remember, the more proactive you are with your insurance company, the better success we're going to have on the back end fighting for you.